Myself, Dr. Jineshwar Yaligouda, Head of Department, Gulabra Patil Homeopathic Medical College, Meerut. Today we are going to study the anatomy of liver. In that we are going to study the synonym of the liver, introduction of the liver. Then next we are going to deal the external features of the liver, relations, peritoneal visceral relations of the liver, and we are going to study the blood supply, venous drainage, lymphatic drainage, nerve supply and functions of liver. Then we are going to study the clinical anatomy of liver. So this is a liver organ which is we are going to deal today. In this you have to remember the liver, which is a synonym which is derived from the Greek word that is we call as an hepar. Hepar means hepatic, that relates to the liver. So that is a synonym of the liver. Then going to the introduction of the liver. This liver, which is we are going to see, this is one of the largest gland of the body, and it is also the one of the biggest organ of the intra-abdominal organ. So that liver is one of the largest gland of the body, and it is the biggest intra-abdominal organ of the body, situated in the right hypochondriac region. And this is one of the liver which is many functions are done by the liver, like a metabolic function, synthesis function, and we are going to get the excretory, storage, and we are going to get the antibody formation. All these are the main functions of the liver. So this is all about the introduction of the liver. Next, going to the, after this we are going to deal about the, that is what is the location of the liver. Liver is located on the right hypochondriac region. So it is on the most of the right upper quadrant of the abdomen it is situated. So that is in our body, this is the anatomical position of the liver. It is situated in the right hypochondriac region. And also it covers the epigastric region, and it is extending, that is the left lobe, to the left hypochondriac region. So liver is located or situated in the right hypochondriac region, epigastric region, and left hypochondriac region. Then what is the color of the liver? Liver is a reddish brown in color, as you get the reddish brown color of the liver. Then it is having the weight, that is the size you are going to get about it is a pyramidal in shape, and it is a wedge shape, and it looks like a four-sided pyramid. So shape will be the wedge shape, and it is having the reddish brown in color. We are going to get the reddish brown, or we are going to get the liver color. And in this you have to remember the, it is located in the major right hypochondriac, epigastric, and left hypochondriac region. This is about the size, shape of the liver and color of the liver. And as you get the, it is a shape is wedge shape, so that this liver is appears like a four-sided pyramid. So as like this is apex like we are going to get, this is a base like we are going to get in the liver. So this is appears like a four-sided pyramid. So wedge shape. Then what is the weight of the liver? Whatever the weight will be, we are going to get in the males, we are going to get the 1400 to 1800 grams. That is a 1.4 to 1.8 kg. We are going to get weight of the liver in the males. In the females, it is about the, that is a 1200 grams to the 1400 grams. In fetal, we are going to get the, that is a 150 grams weight of the liver. So after this external features of the liver, we are going to proceed for the, what are the other external features we are going to get. So this is all about the location of the liver. Then I have told the size, shape, and color and weight of the liver. Then next, going to the external features of the liver. In this liver, as you see, this liver is having the one prominent inferior border. This is we call as a prominent inferior, which is we call as a prominent inferior border, and it is having the two lobes. One is we are going to call, this is all is the right lobe of liver, and this is the left lobe of liver. And also right lobe of liver is consist of the caudate lobe and this is a quadrate lobe. So we are going to have the quadrate, we are going to get the caudate lobe, and this is a quadrate lobe of the liver. So liver consists of the right lobe and left lobe and one prominent inferior, this is the inferior prominent border of the liver. Next, after this, we are going to deal about the surfaces of the liver. Liver has the 5 surfaces. One is we are going to get this is the one anterior surface, and we are going to have this is a superior surface, superior, this is the anterior, this is the right surface. And on the posteriorly we have this the posterior surface of the liver, and this is the inferior surface of the liver. Means what? This is the inferior surface and this is the posterior surface of the liver. Then we have the anterior surface of liver. Then we have the superior surface of the liver and right surface we are going to get. So this is all about the 5 surfaces of the liver. So in the external feature you have to write, able to write one inferior border, prominent inferior border, which is marking that the separating the anterior surface and inferior surface. Then we have the lobes, right lobe of liver, left lobe of liver. Right lobe again subdivided into a caudate and quadrate lobe of the liver. Then I have told the 5 surfaces. This is the anterior surface of the liver. Then we have this is superior surface of the liver, right surface of the liver. Then we have this is the posterior surface of the liver. This is the inferior surface of the liver. So these all are the 5 surfaces of the liver. Then going to the what are the relations of the liver. So when you see the relations of the liver, you have to remember there are 2 separate relations you have to remember: peritoneal relations and visceral relation. What are this about 1800 grams liver is supported by the ligaments attached to it. So we are going to have almost all the liver is covered by the peritoneum, and we are going to get the peritoneal folds we are going to get, and those are we are going to call as ligaments. Here, what are the ligaments which are our peritoneal relations we are going to get? First, in the peritoneal relations, you have to remember almost all the liver is covered by the peritoneum. Then afterwards, it is having consist of the bare area of the liver or the main bare area of the liver. So also it is having the groove for the inferior vena cava, fossa for gallbladder. This is fossa for gallbladder, and we are going to have the porta hepatis. So porta hepatis, fossa for the gallbladder, and groove for the inferior vena cava, and bare area and main bare area. So almost all these are the peritoneal relations of the inferior and posterior surface of the liver. So also third point you have to remember, this is supported by the attached ligament, peritoneal folds. These ligaments we are going to study. What are the ligaments or the peritoneal relations of the liver? So you have to mention almost all the ligaments of the liver. So ligaments of the liver we are going to get, that is the first one. This is a falciform ligament, which is we are going to get this is a falciform ligament. Next we are going to get here on that is a left coronary ligament. That is a left triangular ligament. This is a left triangular ligament. Then we are going to get here right, that is we are going to get the superior coronary ligament. Here we have inferior coronary ligament, and here we have the right triangular ligament. So right triangular ligament, inferior coronary ligament, superior coronary ligament, this is and we are going to have here is we are going to get the left coronary, that is a left triangular ligament. So left triangular ligaments, once again to revise, the anteriorly it dividing into a right and left lobe by the falciform ligament. This falciform ligament divides the liver into that is a right lobe, left lobe. So this is a falciform ligament. Here we are going to get the left triangular ligament. Then we are going to have superiorly here we are going to get the superior coronary ligament, then inferior coronary ligament. Here we are going to have that is a right triangular ligament. So other ligaments which is we have near to the inferior vena cava, this is the ligamentum venosum. This is the ligamentum venosum and ligamentum teres. So ligamentum teres, ligamentum venosum, we have the right triangular ligament, inferior coronary ligament, superior coronary ligament we are going to get. Then we have the here falciform ligament, and this is we call as that is a left triangular ligament. So these all are the peritoneal relations and ligaments attached to the liver. So that this liver is suspended by these all are the following ligaments. Then going to the visceral relations, that is all 5 surfaces relations we are going to deal. So first in the visceral relations we are going to deal, that is the anterior surface relations of the liver. So anterior surface appears like a triangular in shape, triangular area we are going to get, and this is we call as an anterior surface of the liver. And this anterior surface of the liver, which is relations, it is related to in the middle we have the gyphoid process, anterior abdominal wall. And on this we are going to get the subcostal margin, right subcostal margin is related. We are going to get the rib marking on this, which is we are going to get on the anteriorly. So anterior surface is related by the subcostal margin. Then I have told in the anteriorly it is a gyphoid process, anterior abdominal wall, and here on the superior area it is attached by that is we call as a right dome of diaphragm, left dome of diaphragm. So these all are the anterior relations, that anterior surface relations of the liver. Then going to the posterior surface. So this posterior surface which is we are going to deal here, that is I am going to show in this specimen liver. So what are the posterior surface? This is the posterior surface of the liver. In this posterior surface liver related to the first one, here we have the esophagus, that is we are going to get. Then we have the here ligamentum venosum, and this is a caudate lobe, and this is a groove for the inferior vena cava, and we are going to get the main bare area we are going to get, and we have the here that is a right suprarenal gland. So right suprarenal gland we are going to get, bare area, main bare area, groove for the inferior vena cava, we have the caudate lobe, and we have the ligamentum venosum, and we have the here impressions for the esophagus. So these all are the posterior relations of the liver. So going to after this we are going to deal about the inferior surface of the liver relation. So in the inferior surface of the liver we have the stomach is related, here stomach part is related, then pyloric part of the stomach we are going to get, and second part of the duodenum we are going to get the second part of duodenum, and this is we call as a quadrate lobe. This is a quadrate lobe and ligamentum teres, and we group for the ligamentum teres, and we have the stomach. We are going to get the body part of the stomach, pyloric part, and we have the second part of the duodenum, and ligamentum we are going to get the ligamentum teres, and we have the gallbladder, fossa for the gallbladder. Here we have the colic impression, hepatic flexure of colon, and we are going to get here as the right kidney. So right kidney is related to the inferior surface of the liver. So this is the right kidney. Then we have the hepatic flexure of colon, fossa for gallbladder, second part of duodenum, and we have the quadrate lobe, ligamentum teres, and stomach. So these all are the inferior surface of the liver relations. Going to the superior surface, when you go to the superior surface of the liver, this is superior surface of the liver. This superior surface of the liver, which is on the both the side, it is covered by the dome of the diaphragm, which is covering right dome, left dome of diaphragm. In the centrally, it is situated by the, it is separated by the, which is we call as the heart and pericardium. Heart and pericardium are separated at the center of the superior surface of the liver. In this, it is separated from the, whatever we are going to have, the heart and pericardium are separated at the center region of the liver on the superior surface. Then both the side, we are going to have the both the side. It is separates the, having the attachment or relation to the left dome of diaphragm, right dome of diaphragm, which is separates the left side. It is separating from the, we get the left lung and left pleura, and right side we have the right lung and right pleura. So both the side diaphragm is separating from the left side, separating, it separates from the, we are going to get the left lung, left pleura, we are going to get right side, right lung, right pleura separated from the duodenum on either side of the superior surface of the liver. Centrally, heart and pericardium are separated. And this inferior vena cava coming out from the liver, and it is opens into the right atrium of the heart. So this is the inferior vena cava. So after this is the superior surface we have dealt, anterior surface we have dealt, then I have relations of the posterior surface, and this is the inferior surface. So 4 surfaces we have dealt. Then going to the, we have the, this is the right surface. So right surface of the liver we can divide into a, this is a one, lower 1/3, middle 1/3 and upper 1/3. So upper 1/3, middle 1/3, lower 1/3. So this is division. Then lower 1/3 relates to the, we have the diaphragm, pleura, and we have the lung. Then middle 1/3 relates to the, we are going to get the, that is the, we have the pleura and lung. Then we have the superiorly, it is separating from the, that is the pleura and lung. So upper 1/3, middle 1/3, lower 1/3. So lower 1/3 is diaphragm, pleura, lung. Then you have to leave the diaphragm, then you have the pleura and lung in the middle 1/3 and superiorly lung. So this is all about the relations of the right surface of the liver. So in the inferior surface, we have the, I have told in the lobes of the liver, it is the right lobe of liver and left lobe of liver. This right lobe is bigger, which is having the, again 2 parts, 2 lobes we are going to have division. This is a caudate lobe and this is a quadrate lobe. So this is the quadrate lobe which is we are going to get, and this is a caudate lobe. So in between the 2, which is a quadrate and caudate, there is a transverse fissure, 2-inch transverse fissure in between on the inferior surface between the quadrate and caudate, that is we call as a porta hepatis. This porta hepatis, which is we are going to get the transverse ridge, which is we are going to call as that is a porta hepatis, that is a transverse fissure on the inferior surface of the liver between the caudate and quadrate lobe, that is we call as that is a porta hepatis. What it consists? It contains the portal vein, hepatic artery, and we are going to get hepatic plexus of nerve and bile duct. All these are the content of the porta hepatis. Then we have the one which is, this is a caudate lobe. This is a caudate lobe which is situated on the posterior surface of the liver, and which is bounded on the right side. We have the groove for the inferior vena cava. On the left side, that is we are going to get the ligamentum venosum, and it is superiorly continues as a superior surface of the liver, inferiorly related to the porta hepatis. These are the boundaries for the caudate lobe. So caudate lobe, which is present on the posterior surface of the liver, which is bounded right side by the groove for the inferior vena cava, and left side we have the groove for the ligamentum venosum, and we have the superior, on the posteriorly it continues as a superior surface, and inferiorly we have the porta hepatis. So this is all about the boundaries of the caudate lobe. Then going to the quadrate lobe, this is a quadrate lobe is situated in the inferior surface of the liver. This is all is the inferior surface. So this quadrate lobe is inferior surface of the liver situated. It is bounded anteriorly by the prominent inferior border, posteriorly by the porta hepatis, right for the fossa for the gallbladder or the gallbladder, and to the left we have the ligamentum teres. So ligamentum teres on the left, to the right we are going to have the fossa for the gallbladder or gallbladder, posteriorly porta hepatis, anteriorly prominent inferior border. So these all are the caudate and quadrate lobe boundaries. So you have to remember what is a porta hepatis. Porta hepatis is a 2-inch transverse fissure between on the inferior surface between we have quadrate and caudate lobe, and that is we call as a porta hepatis. What it consists? It consists the portal vein, hepatic artery, bile duct, and hepatic plexus of nerve. So this is all about we are going to get as a contents of the porta hepatis, boundaries of the quadrate lobe and caudate lobe. We are going to get all these are you have to. This is the fossa for the gallbladder, very important, you have to see. And bare area, we are going to get this all is a bare area which is we get. So this is the colic impression, we are going to get. This is the colic impression. So this is all about the liver. When you see this is affected, very severely affected liver, so color is changed. So we have the reddish brown color, which is the normal, that is we have come across in this liver, which is we are going to get as a liver difference color. You can reddish brown color, you are going, this is normal and this is the abnormal. So this is all about the relations of the liver. So next is what is the blood supply of the liver. We are going to receive the blood supply of liver is by the 80% by the portal vein and 20% by the hepatic artery. So almost all the liver is a very much vascular, and this liver receives the total blood supply, that is a blood supply from that is 80% portal vein and 20% hepatic artery. Why it is 80% portal vein? Because almost all the superior inferior mesenteric vein and they joins with the inferior vena cava, and almost all the abdominal venous blood is brought by the superior inferior mesenteric veins to the portal, that is the portal vein, and we have that is the inferior vena cava to the right atrium. So almost all the venous blood crossing the liver, meanwhile it receives the maximum blood supply, so that it is 80% by we have the portal vein, 20% by the hepatic artery. Then venous drainage of the liver. Liver drains venous drainage through the hepatic sinusoids. Then we are going to get the portal vein, that is draining. We get the hepatic that is opens into the portal veins. So portal vein, that is the drains, and the hepatic sinusoids we are going to get. Those are venous drainage of the liver. Lymphatic drainage, we have the hepatic and celiac group of lymph node. Hepatic and celiac group of lymph nodes drain the total, that is a lymphatic drainage of the liver. What is the nerve supply of liver? Liver is supplied by the hepatic plexus of nerve. We have the hepatic word which is related to the liver. So hepatic plexus of nerves which are supplying that is a nerve supply to the liver. So in this we have sympathetic and parasympathetic, and sympathetic and parasympathetic they derive from the hepatic plexus, and parasympathetic by the vagus nerve. So that is all about the nerve supply of the liver. So first to revise: blood supply 80% portal vein, 20% hepatic artery. Then venous drainage, we have the hepatic sinusoids drains into the portal vein. Then we have the lymphatic drainage, hepatic group of lymph nodes and celiac group of lymph nodes. Then nerve supply, that is a hepatic plexus of nerve, that is derived from the sympathetic and parasympathetic, parasympathetic by the vagus. So all these we are going to get as a blood supply, venous drainage, lymphatic drainage, and nerve supply of the liver. Then next is important is What are the functions of the liver? So this is the liver which is having the many functions in our body. First function, which is the metabolic function. We have the liver functions: metabolic, we have synthesis, we have secretory, we are going to get excretory, we have protective and storage. All these are the functions you have to study in the liver. So liver, which is we are going to get in this, first is metabolic function, metabolism of protein, fat and carbohydrate. That is the one which is important. Then we are going to get synthesis. It synthesizes the bile, which is secreted, produced in the liver and stored in the gallbladder. So bile synthesis and prothrombin. Then excretion. Excretory function is it excrete the heavy metal, poisonous all. Then we are going to get the conjugation. Conjugation, which is poisonous metals and all, they are diluted in the liver and they are metabolized, and they are the strength of the poisonous is reduced. That is we call as a conjugation. Then we are going to get the storage. We are going to get glucose is converted glycogen in the liver, that is stored in the liver. Vitamin A and D, K all is stored, and blood also stored in the liver. So metabolic function, then we have the synthetic, then we have the excretory, and next is storage. Then third is protective. Conjugation, I have told protective, production of antibodies, all that is done by the liver. So this is all is the function of the liver. Then lastly, we are going to deal about the what is the clinical anatomy of liver. So when you see the we are going to deal, that is the clinical anatomy of liver. So in this first you have to remember about the that is hepatitis. So we are going to get the inflammation of the liver called hepatitis. That is you have to remember. That is maybe infective hepatitis we are going to call. Then one symptoms which is we are going to get sign and symptoms we are going to get in the liver, we have to find out, that is a jaundice. That is yellowish discoloration of the conjunctiva and sclera. That is we call as the increased blood bilirubin level, called as a we are going to call it a jaundice. So first one, hepatitis, we have the acute and chronic hepatitis. Then second one, we are going to have the that is a sign and symptoms we are going to get relating to the liver is we call it the jaundice. Then third one is, as we want to palpate the liver on the right hypochondriac region, usually liver is not palpable. It is only palpable when it is enlarged. So liver, per abdominal palpation of the liver, that is liver is not palpable. So it is enlarged, then we are going to palpate on the below the right subcostal margin. Then you have the fourth function, that is we have the hepatomegaly. That is the enlargement of the liver, we call it a hepatomegaly. In this we have commonest cause for the hepatomegaly, we have the typhoid and malaria. Typhoid and malaria is the disease where the commonest disease where we can get the hepatomegaly. Then next we have that is the cirrhosis of liver. Due to the alcohol consumption, the liver is damaged, and that condition we call as a cirrhosis of liver. And lastly, we have the abscesses in the liver. That is, we have in this condition you can remember liver abscesses. Which is we have here liver abscesses, cavity in the liver you can see. Cavity in the liver you can see, that is abscess in the liver. This is a major one of the important specimen in our museum. That is a cavity which is a very big cavity inside the liver is seen. That is we have. Then we study the portal venous system, how that is divided portal venous system in the liver division, that is shown by the dissection of the interior of the liver. So this is which is we are going to get that is a portal system shown in this by the different division and repeated patterns of the portal veins in the liver, that is the interior of the liver. So next, lastly, there is an applied anatomy comes, that is you have to remember is that is the cancer of liver. So we have the amoebic liver abscesses, then we have the lastly that is the cancer of liver. So what is applied anatomy? I have told palpation of the liver. The liver is not palpable. It is a palpable when it is enlarges. That is condition we call hepatomegaly. Right subcostal margin we can palpate. Normal liver is not palpable, but it is enlarges. We can palpate on the subcostal margin, right subcostal margin. Second, I have told hepatitis, inflammation of the liver. That is called the hepatitis. That is we have the acute and chronic hepatitis. Third, I have told that is a hepatomegaly. Hepatomegaly is a enlargement of the liver. Commonest diseases which is causing hepatomegaly are we are going to get we get that is a typhoid and malaria, and even we have the cirrhosis of the liver. Then I have told you have to also remember the liver transplant. Then we have get the cancer of the liver amoebic abscess we are going to get, and one signs and symptoms given by the liver diseases are that is a jaundice. So this is all about the liver, anatomy of liver, study of liver under the following head: synonym, introduction. Then I have told the external feature, size, shape, color and weight of the liver, peritoneal relation, visceral relations, then blood supply, venous drainage, lymphatic drainage, nerve supply. Then I have told the functions of the liver, what is porta hepatis I have told, then clinical anatomy of liver. So this is all about today's my topic, that is the liver.